Assalamualaikum and hello ladies and gentlemen. Welcome to our video presentation. First of all, I want to introduce myself and my partner. My name is Siti Nur Zafira binti Satinin and my partner's name is Lore Langkom Anak Ludo. We are students from group SR 2432A. We are going to present about our title, which is Cardiovascular Fitness. Alright, first and foremost, introduction of cardiovascular fitness. What is cardiovascular fitness? Cardiovascular is refer to the capacity of cardiovascular system to supply oxygen to muscle and whole body efficiently during physical activity. Three test methods that we choose are BLEEP test, 1.5 mile or 2.4 kilometer run test, and 3-minute step test. Alright, I'm going to explain BLEEP test first. BLEEP tests are known by several names, which is BLEEP test, pacer, and multi-stage run test. BLEEP tests are developed to measure an individual cardiovascular fitness level and to measure the maximum oxygen uptake during physical activity. In this test, participants are required to run between two cones placed 20 meters apart and then syncing with the beep sound from the BLEEP test audio. BLEEP tests consist of 21 levels and running speed increase each time the level up. The equipment needed in BLEEP tests are non-slipping flat surface, measuring tape that is 20 meters long or more than 20 meters, and then marking cone to mark the 20 meter apart track, audio player and BLEEP test audio, and lastly scoring sheet. Alright, next slide is BLEEP test procedure. BLEEP test procedure consists of two phases, which is phase 1 is pre-test and phase 2 is the real test. During pre-test, all participants are required to fill in both health consent form and information form. In health consent form, participants must fill in their health information to confirm that the participant has no health problem, especially heart problem, to avoid injury during the test. While information form is to fill in participant names, age, gender, and sometimes identification card numbers. These information are important to determine a participant scores, category, and their cardiovascular fitness level. While all participants is filling their form, the organizer should measure out the track for BLEEP test by measuring tape, which is 20 meters apart, and then place marking cone on each end. Besides that, test organizer should test their audio player first before conducting demonstration and test. After participants finish filling their form, participants are required to perform an adequate warming up. As soon as the participants are finished warming up, switch on their audio player to prepare for demonstration. The test arranger should explain the test procedure first, then conduct a demonstration. The second phase of BLEEP test procedure is the real test. First of all, participants are required to stand behind the cone, facing the other line. Switch on the BLEEP test audio. Participants must listen carefully to the instruction given by the audio. When the first beep sound are heard, it signifies that the first level of the first shuttle has started, and all participants can run to the other end with their own pace. This is the audio example of BLEEP test.
Stop level 1.
On the first level, the time for the next beep to reach are a little bit longer. The participant that reach the other end must wait for the next beep to run back to the other end. These are the audio for the next level.
Stop level 1.
Participants will get warning for the first time when they cannot reach the end before the next beep sound. The second time participant unable to reach the end before the beep sound can cause the participant to be eliminated from the test. The last level of their last shuttle are the participant BLEEP test score. The participant that has finished the test must perform cooling down to prevent further injury and muscle fatigue.
So here's the video example of BLEEP test.
Meter shuttle run, also known as the beat test. You'll run back and forth between two lines that are 20 meters apart to test your cardiovascular endurance. Keep in mind this is a time test. It's going to start off slower and progressively get faster. You want to continue to run until you can no longer keep up with the pace.
Alright, next slide is for normative data for BLEEP test. Table 1 shows normative data for male and table 2 shows normative data for female. This next slide is about the do's and don'ts in BLEEP test. For the do's in BLEEP test, first of all, participants are advised to start level 1 with slow running pace. The second one, participants should eat proper food before the test. The third one, participants must warm up before the test. The fourth one,
Hydrating before test are the most important things. And number 5 is eating 1 to 3 hours before test.
next up is the don'ts in BLEEP test.
Number 1, participant shouldn't sprint on the first level. Number 2, running with an empty stomach is a huge mistake. Number 3, did not warm up
adequately. Number 4 is did not hydrate properly before test. Number 5 is eating just before the test. And number 6, adding training weight before the test. Next slide is about advantage and disadvantages in BLEEP test. For advantages, number 1, a BLEEP test can be performed in large group at once. Number 2, BLEEP test only require a minimal cost, so it can save some money for the test organizer. Third one, BLEEP test is effective method to measure cardiovascular fitness or aerobic endurance. As for disadvantages, the first one, environmental condition can affect the result. Number 2, motivation level can also affect the result of the BLEEP test. And the third one, practice can also affect the scores. Alright, moving on to the next test, which is 1.5 mile or 2.4 kilometer run test. The purpose of 1.5 mile or 2.4 kilometer run test is to measure an individual aerobic or cardiovascular fitness and to estimate the body's cardiovascular system ability to deliver oxygenated blood to the muscle and throughout the body. In this test, participants are required to run 1.5 mile to 2.4 kilometer and finish at the shortest time as possible. Walking during the test are allowed but strongly discouraged. Participant cardiovascular fitness score is the participant's finishing time of the test. Other than that, the participant cardiovascular fitness can also be estimated by calculating their maximum oxygen intake, VO2 max, below. In this test, there are only three equipment needed, which is running track that can cover 1.5 mile to 2.4 kilometer, then a stopwatch, also the scoring sheets. Alright, next up is 1.5 mile or 2.4 kilometer run test procedure. These tests are also consist of two phases, which is pre-test and the test. Phase 1 of 1.4 mile or 2.4 kilometer run test consists of obtaining participant health consent via health screening using a form. This step is crucial step to ensure all participants are healthy and able to engage in the test without any problem and in their own will. After that, participants must fill in their information such as names, age, gender, and identification card number if it's needed in the form given by the administrator of the test. This information is important to estimate participants' scores, staff, and their cardiovascular fitness level. After participants finish filling their forms, the administrator should supervise and perform adequate warming up for all the participants to prepare their body to do physical exertion. After warming up, explain the procedure of 1.5 mile or 2.4 kilometer run test to all of the participants. Phase 1 of 1.4 mile or 2.4 kilometer run test is the procedure to run the test. Starting with all participants getting ready on the start line of the running track. After the administrator of the test command go, all participants can run with their own pace, and at the same time, the watch are starting to record their time. During the test, participants can run or jog on their own pace. Walking are allowed, but strongly discouraged because the time stopped and participants required to record their finishing time as soon as possible. After finishing the test, all participants required to perform cooling down. These are the video of 1.5 mile or 2.4 kilometer video procedure.
Start. You will line up behind the starting line. When told to go, the clock will start. You will begin running at your own pace. To complete the 1.5 miles, you will need to complete a required number of laps for the track being utilized and finish at the predetermined finish line.
So, these are the normative data for 1.5 mile or 2.4 kilometer run test. So here's the calculation example. These are the formula to calculate VO2 max, which is 483 divided by a participant finishing times plus 3.5. This amount are fixed amount for 1.5 mile to 2.4 kilometer VO2 max calculation. Here's example. Participant A is a male at age 25. So this participant finished at 12 minutes 30 seconds. So participant A has a score of VO2 max 42.7. According to the table, participant A VO2 max score is categorized in good. This one. Alright, next up is the do's and don'ts in 1.5 mile to 2.4 kilometer run test. For the do's, participants are advised to run on their own pace. Number 2, participants must eat proper food before test. Number 3, participants must warm up adequately before the test. Number 4, participants must hydrate before the test. And number 5, participants must eat 1 to 2 hours before the test. The don'ts in 1.5 mile to 2.4 kilometer test. Number 1, participant should not running with an empty stomach. The second one, participant did not warm up. Number 3, participant did not hydrate properly before the test. Number 4, eating just before the test. Number 4 is adding training weight before the test. And the last one, running too closer to the other participants. That's all for do's and don'ts. And next up is advantage and disadvantages of 1.5 mile to 2.4 kilometer run test. The advantages of this test: number 1, this test can be performed in large group at once. Number 2, it only requires minimal tests to perform it. Number 3, it is an effective test to measure cardiovascular endurance or aerobic endurance. As for disadvantages, number 4, environmental conditions can affect the result. Number 2, motivation level can also affect the participant result. Number 3, practice can affect the participant score. And number 4, this test requires a long track. That is all from me. My partner will explain the next part of our presentation. Thank you for your attention.
A very good morning to our lecturer, Miss Patricia Pawa, and my fellow friend. So today I'm Lorel Langko. I would like to continue what have been presented by my group member, Siti Nur Zafira, about the cardiovascular fitness test. Okay, this one is the last test, which is the 3-minute step test. What is the 3-minute step test? This test is the designation to measure the fitness of person aerobic, and this test also prepare for participants step up and down, on and off for 3 minutes to increase heart rate and to elevate the heart's recovery rate. And what is the purpose of this test? This test is to measure aerobic cardiovascular fitness level based on how quickly the heart rate returns to normal after exercise. The fitter person measure on how quicker of heart rate return to normal after exercise. Okay, with example is when we look at the athletes, they have a quicker of heart rate return to normal after exercise because they are trained compared to untrained person. Okay, this one is the procedure of the 3-minute step test. Okay, the first one is make sure the participant has signs the fitness testing consent and release, and the second one is follow the contraindications for testing and guidelines for stopping the step test, and then the third is explain to the participants about the importance of sitting down quickly at the end of the test, and the fourth is instruct the participants on stepping up using the same legs up up down down, and then set the metronome for 24 beats 96 steps per minute, and then start the timer when the participants begins stepping up, and inform the participant of the time as it passes. For example, 1 minute left, 30 seconds left, and 10 seconds left. Okay, the last one is ask the participants to place the fingers firmly on the radial artery and start counting 5 seconds after the test was completed. Okay, this one is the tutorial video of the 3-minute step test.
For 3 minutes. Using a metronome, men will step at a cadence of 24 beats per minute, whereas women will step at a beat of 22 beats per minute. Another option is to set the metronome 96 beats per minute for men or 88 beats per minute for women. This ensures up, up, down, down type cadence. At the conclusion of 3 minutes, the subject stops and palpates the pulse while standing within the first 5 seconds.
Okay, if we look at the video was followed the procedures given. Okay. Okay, and then we go to the normative of the 3-minute step test. If we look at the schedule, fit score, excellent, above average, average, below average, and poor. And the age is 18 to 25, 26 to 35, 36 to 45, 46 to 55, and 56 to 65, and 65 above and above. Okay, we try to get an example. Okay, for men at age 18 to 25, he should have less than 82 beats to get an excellent result. And for women, she should get 80 less than 88 score to get an excellent result. Same goes to the another age. Okay, this is the supplies or equipment for this test. The first one is metronome, and then 12-inch high aerobic type step with risers, and watch or clocks that count second. Okay, this slide shows the do's and don'ts in the 3-minute step test. Okay, do's: eat 1 to 3 hours before the test. Hydrate before test. Step up, follow the rhythm. Yes, this is important to uh, to get the proper result at the end of the test. And warm up before the test. Of course, this is also important because we can avoid some of injury. And then eat proper food before the test. Okay, we should take the proper food such as carbs, that food that contain carbs, protein, to get more energy to do the test. And then don't step up too fast. Okay, if we step up too fast, it will influence the last result of the test. And then stepping with empty stomach. Okay, this also important because we don't don't want to get any injury or get tired, because we have empty stomach, we easily to get tired during the test. Do not warm up before the test. Yes, this is also important because we can avoid what kind of injury if we warm up before the test. And then did not hydrate before the test, and adding training weight before the test. Okay, don't do this adding training because we will get tired easily or earlier than other participant during the test. Okay, this slide shows the advantages and disadvantages of the 3-minute step test. The advantages of this test is low cost for equipment. Okay, if we look at the equipment, metronome, watch or clock, and 12-inch step type, it easily to buy or get in our area. Ease of portability, natural activity. Yes, step up is our natural activity because in our daily life we always step up, such as step up upstairs and so on. Okay, and the last one is permanent calibration. Okay, we go to the disadvantages. The first advantages is testing large group with this test will be time consuming. For example, if we conduct the test in the large of group in a small area, it will be consume more time because we should to divide the participant to the small group so that they can do the exercise, the test. And then difficult to maintain the pace. Yes, of course, for the older participant or uh, body weight, their participant have a body weight, a high body weight, they will difficult to maintain the pace compared to skinny person or participant. And the last is body weight has also been shown to be factor. Yes, of course. And then the last is the conclusion. The first is 3 types of cardiovascular. First is BLEEP test, 2.4 kilometer run test, and 3-minute step test are very important to maintain our body to stay healthy. And this test can enhance psychological or mental strength to achieve the goal. For example, to reach cone by cone in BLEEP test. And these tests also lead to physiological fitness when the body extracts the unneeded material by sweat, especially for 2.4 kilometer run test. The last is these tests used in many major organizations for the testimony to its reliability and suitability. Of course, nowadays, when we try to get a job, we have to have resume. In the resume, they need us to uh, put our curriculum result. in our secondary school or in primary school, because if we have a good curriculum result, so that we will take to that job. Okay, that's all for me and for my group. Thank you.